The postpartum visit is a key visit, especially when we talk about interconception health. It's really the jumping off point to interconception health. And if you look around in the literature and just in practice, there's no standardization. Everyone's doing something different. So what I wanted to do was I wanted to go into this and poll the community and see what the providers are saying, and try to standardize that visit and make it an easier visit that has some sort of outcomes that can be measured. And what you have in front of you is the toolkit that I created. What I want to do, I only got 10 minutes, so I want to make sure I use this time wisely. What I want to do is I want to take you through the contents very quickly of the toolkit in front of you. And I'm going to show you a quick video that's a part of the toolkit as well. Talk to you a little bit about some of the data that I've collected, which is still preliminary, and I'm still collecting. And then if I have time, I certainly can field any questions that you may have. If you open up your packet, you'll see to the left-hand side is provider information. You can pull out the questionnaire. This is the backbone of the toolkit right here. And this is a questionnaire that we created after much input from the community. When we initially started, we thought we were going to do one that covered the clinical components of a postpartum visit as well as the social components. After we listened to the community, the providers kept saying, I really need more help on the social pieces, social components of a postpartum visit. What is happening around behavioral health, what is happening around substance abuse, domestic violence, and where can I refer these patients to? So when we started, it was much broader. We decided to hone in on the social pieces of the postpartum visit, and this is what this questionnaire reflects. So if you look at it briefly, you'll see that we're covering things such as depression, for the Edinburgh score, substance abuse, using SBIRT for that, looking at things like smoking, domestic violence, physical activity, reproductive life plan, as well as ongoing clinical care. And what we did is on the next sheet that this is connected to, we gave community resources. And this is a laundry list in the Forsyth County area of community resources for each question. So if the provider, they went in, the ancillary staff would give this to the mom that was coming for the visit, they would fill it out, the provider would look at it, they would have a conversation, and then if they needed to make a referral, they would use these community-based resources to make that referral. So that was the idea behind the questionnaire. Identify the social components and then make a referral to the community. If you look behind the questionnaire, you'll see some things such as the depression scale that we used. When we used SBIRT, we screened not only for drug abuse, but we screened for alcohol abuse. You'll see some questionnaires there. And if you just keep going back, you'll see some a grading tool for the SBIRT, as well as other documents, family planning program, make sure that they were filling that out. And we also looked at what were some free clinics or clinics that provided affordable sliding scale type services in the community. This tool not only helped the provider standardize what they wanted to do at this key visit, so everyone was doing the same thing, but it has another benefit, and if anyone here has heard of the Pregnancy Medical Home, that's an initiative Community Care in North Carolina has rolled out. And providers that are agreeing to be a pregnancy medical home, OB providers, can get $150 for the postpartum visit screening. $150 extra on top of what they're already billing the global fee. This highlights the three things they have to do to get that $150. It highlights the depression screening, it highlights the reproductive life plan, and it highlights the referral for ongoing clinical care. Those are three things that they have to do to get that $150. And this allows them to document that and make sure that that's being done so they can bill for that $150. The practice really liked that. So there was a couple of benefits to that. On the right side of your packet, you see some handouts, and this gets to the things that we were asking about around reproductive life plan. There's literature on that. We got a lot from ACOG around alcohol use. There's English and Spanish versions here. Tobacco use, weight, safe relationships, that gets to domestic violence, folic acid, and other type of handouts there. So this was sort of the way that put forth the questionnaire and then the supporting documents that could help facilitate referrals. The practice that we picked to do this pilot, which is still ongoing, is Lindhurst Gynecology. That's in Winston-Salem. They have satellite sites in Kernersville as well as Mount Airy. And it just so happened that our physician champions for Princeton Medical Home resided there as well. Dr. Carroll followed and Dr. Jacobs. And they were very receptive to putting this in practice. It started February 18th as far as putting this in practice. Since then, we have 90 completed questionnaires have been done. And just to give you a little bit of outcomes from what we've collected so far, of those questionnaires, for the first question on the questionnaire, we had, if you have more than 10, that's a sign of depression. We had 13 people out of those 90 that had depression or screened positive for depression. 33 were not taking folic acid. 22 were not getting physical activity. 18 were smoking, and this is all out of 90. 39 were around others that smoked. And this is key right here. 35 had no ongoing clinical care provided. So when they lose their Medicaid after 9 months, they're not going to anybody. They're leaving the system. And then what's going to happen, they're going to get pregnant, they're going to show back up, and then it's going to be a cycle that repeats itself. So we were trying to connect them to ongoing clinical care. Before I show the video, I just want to mention one other thing. There's 2 surveys on the left-hand side in the very back. There was a client DVD survey and there was a provider survey. We gave this out. The client DVD survey we gave out towards the end of the project, and we've only collected about 25. But overwhelmingly, everyone has found the DVD that I'm about to show you very beneficial, and thought that it was a good complement to their visit. And we also did a survey for the providers on what they thought of the toolkit. And we didn't get a uniform response of that it was all beneficial, because we were trying to implement a new process into an already crowded practice. But I would say it was 50-50, and we're continuing to have conversations on how we can better integrate. So the other piece of the toolkit, and this is what I want to show you for the remainder of my time, is a DVD. I created a DVD by using local resources in the community. I work very closely with the Forsyth County Infant Mortality Reduction Coalition. We used real moms in the community at the health department, and we asked them to speak about their postpartum visit experience.